If you did not know, this month is National Nutrition Month. This morning we are discussing some ways that you can improve your eating habits. Dr. Surani joins us live to discuss. Dr. Surani, good morning to you. So good to see you. Thank you so much for being with us this morning. I know it's important to eat healthy. It's important for everybody and for your health. But what is the best way to eat healthy and actually enjoy it?
Good morning, Barbie. Glad to. I think the most component food exercise. You have a good food and exercise, it will make a healthy body and healthy mind. The key factor is that you have to have a good balanced diet. There are certain things which we all know, which we don't really take into action. Anything which looks nice, pretty, multicolor, that's one of the things should be on a plate. Your plate should not be as one bland color. Because if you have a multicolor, it means you are using the vegetables and fruits in a right proportions, and that can lead to a better thing. If you have to do, there are three things you need to know. Number one, what three things you can do in your diet, which can really try to eliminate the risk of poor health. What are the 8 or 9 things you can do? And third thing is we need to consider today is in the area when the access issue would be there, shortages there, should we keep on looking from store to store or we modify? So three things, very simple, everyone knows: cut down your sugar, decrease your salt, and decrease your saturated fat. These are the three key culprits. Focus on color, as I mentioned. Sugar, we don't take into account. If you have a 2,000 calorie diet, you need a 10% calories in sugar. That's just like 200 calories. And if you take a 116-ounce soda, that's about close to 180 calories. You're done for the day. So try to use some other alternative. Spice the thing up. The spice can give the flavor. Even if you decrease the salt content, it doesn't have much of the health hazard. Drink plenty of water. It's just going to keep you hydrated, help you. Add some fiber in your diet. Trim the fat. Eat more fish rather than going for the beef, and look at the bigger picture. Try to have a balanced diet. And especially when you're looking at the healthcare access issue, don't get focused. If you don't find the grapes, fine, you can eat the berries. If you don't like find the berries, eat the apple. Similarly, in the rice, you go for a different substitution, because rather than going from store to store, you need to learn how you can enjoy. You can try to broaden your spectrum of a diet, or in other words, broaden the spectrum of your healthy diet.
And don't deprive yourself of good foods either. Just moderation. Moderation is key. Thank you so much, Dr. Surani, for being with us. We appreciate you. If you have a question for Dr. Surani, you can text it to the number on your screen, 361-855-6397.